invite Michael and Holly both to do self-introductions and get started.
Thank you, Ben, and thank you, Megan, and thank you to Eric and Dennis and the board, and future thank you to any committees and all the folks that are going to help get the word out. So hello to everyone. I know most of the folks on the Zoom anyway, but my name is Michael Craig, and I own a planning and benefits firm called Pennworth Financial Services in Center City. I've been in business for 20 years and a proud CCPA member for over a decade. And one of these days, I'm going to ask Megan to do some research and find out exactly how long, but it's certainly over a decade. My guess is about 13 years or so. Anyway, over the course of the last few months, I've worked with Ben and my employee benefits partner, Holly Adams, in designing a benefits plan for Center City Proprietors Association members. It's been a challenging and interesting 2020 for everyone, of course, and the timeline to get this out has changed a few times. However, we're very excited that this is the first event sharing the information, and more will follow for people to learn and ask questions, both in a group setting and individually. We look forward to talking with everybody that is interested and seeing what's the best fit for them personally and their businesses. So there's two questions. Why are we doing this and what is it? I spend a great deal of my time talking with business owners, CFOs, HR folks. I speak with people that just started their business to people that have multi-generation family businesses with a couple employees in a WeWork, like where I am, to ones with dozens of employees or hundreds of employees. They could be all in Philadelphia. They can be spread out across the country. All of these companies have different needs. However, they share some common traits. They all want to know what all of their benefit options are. They want to have a benefits partner, not just a broker. They want someone that knows their organization and their culture and will help facilitate that message to their employees. They all want to have an understanding for ways to control costs. They want to have the ability to educate employees on the benefits package so there's engagement on what is actually going on. They want to do all of this while keeping things as simple as possible so they could spend time working on their business. As far as how it works, I'm going to hand it off to Holly Adams. Holly works with businesses from 2 people to 3,000 people. She, like me, has 20 years experience doing this. She's a deep understanding of navigating benefits from the employer and employee point of view. So thank you again to everybody. I'm glad everyone is dialed in here. There will be a lot more information and sessions to follow. Having said that, Holly, the floor is yours. Thank you.
Thanks, Michael. Thanks, Ben. So I'm excited to share with you guys the culmination of building this program. And so we're just going to dive right into it. So welcome to the Center City Proprietors Association benefit launch. We're going to shoot for open enrollment for January 1st, 2021. And so really some people, a question that might arise is, what is the objective? What are we looking to do? So we're looking to create a comprehensive benefit program that pools together all of the association companies to have purchasing power for medical insurance, stop loss, dental and vision insurance, and ancillary benefits. And the reason why we're doing this is to control cost and the desired outcome is to get better benefits. The medical plan or the association medical plan, we call them association affiliations, and they can enroll down to 2 employees. So as few as 2 employees can enroll in the program. We're going to pool together the EINs, which are going to allow better rates, concessions. It's going to build a uniform, robust program across the association. Everyone will be on the same medical network. We're using Aetna. Aetna's in our backyard. They have a very good network within Philadelphia. And the good news is it's also PPO. So what that means to employees is that they can go anywhere they want in the country without referrals. So if they decide they want to go to Sloan Kettering, they can just make an appointment. If they want to go to the Mayo Clinic, or there's a different doctor that they would want to go to anywhere across the country, they can do so without making a referral. making it nice and easy. So basically the medical plan looks like this. So rates will vary. So, and why I say they'll vary is because we will pool them together to get the stop loss insurance, which is the basic thing that that is used to control risk. But the rates will depend on who enrolls in it. So rates will vary from group to group from $300 to $500 per employee, depending upon that company's demographics and health information. The average rate shows up to be about $417 per location. And the way that the plan structure is it's $3,500 deductible cost sharing plan. So when I say cost sharing plan, that means that for like everyday use, you just pay copays. And then for RX, you pay copays. And then for larger ticket items like hospitalization and outpatient surgery, that's where the deductible kicks in. So you'd pay the deductible and then a cost sharing amount, and then the insurance carrier would pay. So that's when we say cost sharing, that's typically what that means. And then there's also a $1,500 deductible plan, which is much richer with a lower deductible, so less out of pocket. Other benefits that are included is there's teledoc available to everyone. And as everyone knows, as COVID continues to persist, teledoc has been an amazing way for employees to have access to doctors without having to actually go to the doctor's office. So you can talk to your doctor online like we're talking to each other. And if you are sick, they can write a prescription. You don't even have to enter your doctor's office. So teledoc I see growing substantially, and this is a benefit given to all of the association members that are part of the medical program. Most rates will be lower than the market rates. So typically pricing will be done by location and this is really to prevent adverse selection. So for example, company XYZ average age is 52 and company ABC average age is 34. So one's an older group, one's a younger group. With the older group, your rates are going to probably fall higher to a $500 rate, but it's still lower than the market. And then for a younger group, your rates are going to fall into the lower 300s. So for example, 325 for an average 34 person, average age 34, relatively healthy group. So rates do vary based on who's insuring, but one of the things that we're working on and that we'll be able to deliver with this program is that pricing should be lower than the market. If you have a healthy group, your rates will come in lower than what you would see on the average market. So basically we're controlling and managing risk. And one, we're controlling the cost by location to prevent adverse selection. It encourages younger, healthy employers to remain in the program. So for example, if we just looked at that program, I said on average, the rates are about $417. The reason why the older group's 500 and the lower group's 325 is because obviously if the average rate's 417, all the older employees are going to join in. All the younger employees are going to say, hey, I'm going to find a better plan, less expensive. So they're rated based on their age and gender so that everyone's winning and there's no exclusions to winning. So and we're managing the risk. So we're underwriting the groups to make sure we have a healthy population and the program is sustainable so that we don't have any, adverse risk or selection so that this isn't a program that is unsustainable. We want to make sure that it can keep moving along and it's a sustainable program for years. So some things to keep in mind when you're looking at your own group, because I said we control risks, there are some things that make it prohibitive to locations. So things like serious medical issues and ongoing treatment. So if your group is currently undergoing a cancer treatment, they have MS, HIV, or other chronic illnesses that are expensive to treat, many of the illnesses above the medication alone is anywhere from $25,000 to $300,000 to treat. So medications that cost that much make it the rates are usually too high to continue on. So it might not be the best fit, but it doesn't mean that we won't look across the entire market. And each year the location will be evaluated. So if you're not going through it right now, and maybe next year or not, you could still look at it in future years if it's not a perfect fit for you now. And if it isn't a perfect fit and you say, I don't think this, I know that, I have a few employees that have some serious things going on, we can also look at the alternative market. So when I say alternative market, it just means our own marketplace. So we can shop out Aetna, Independence Blue Cross, United Healthcare, and see what the market rates look for groups like that are excluded, because we obviously want everyone to be included for medical, and the dental, vision, and Aflac work for anyone. So we will have special considerations in place. So for the overall benefit, so this is basically the breakdown. And the first plan is the $3,500 plan. It is a calendar, it is a plan year deductible. It's $3,500 for individual, $7,000 for family. It does have out-of-network benefits. The out-of-pocket maximum on this plan is $6,600 per individual, and for family, it's $13,200. And when I say family deductibles and out-of-pocket maximums, the way that it works is per person. So per person, they meet the individual calendar deductible and the maximum out-of-pocket, but it caps it so that if, for example, there's a fire and everyone has to go to the hospital and they're hospital for days, or everyone gets COVID and the whole family's hospitalized, it caps you at an out-of-pocket maximum, and it caps you at a deductible for a family. So if you have a family of 4, it's per person, and then caps at 2 people. So it's not, you know, per incident. So if only one person goes, it would be the individual. And the reason why I broke that down a little bit and gave it a little bit more details, it's always a question that comes up. The copays on these are $40 for primary care, $60 for specialist. All preventative care is covered at 100%. So that meaning that when you go get your well visit, it's covered at 100%. If you go to gynecologist, if you're over 35, you get a mammogram, colonoscopies, not if they do a procedure, but if they're just doing the actual preventative part, those are all free. And there's no copays for those. So covered at 100%. So when I said, you know, cost sharing, these are the big ticket items. So inpatient, outpatient, and emergency room, deduct and waived if admitted. Those are all where you meet your deductible first. So and that's where you cost share with the actual insurance company. So you pay your deductible, and then you pay your co-insurance, and then you guys share the cost of that. Urgent care is a $75 copay. There's no limits on the plans. If you go get a prescription, it's $20 for generics. That's what tier 1 is. Tier 2 is branded. It's $50. Tier 3 is non-preferred branded. So things that have crowded classes like heart disease medication or diabetes medication, there's lots and lots of drugs to treat for those. And as such, there's tier 2 and tier 3. Tier 3 is usually also new products. So as new products enter the market, they don't automatically come on to formulary. That's where you pay the $75 versus the $50, just to explain how that works. The second plan was a PPO 1500. Now the benefits pretty much mirror each other. So what I just told you is the exact same on PPO 1500. The real differentiation is the deductible. So underneath the PPO 1500, the deductible is $1,500 versus $3,500, and the family's $3,000 versus $7,000. The out-of-pocket maximum is $5,000, and the family's $10,000. So the overall out-of-pocket costs are less for the PPO 1500 than they are for the PPO 3500. But everything else that I just talked about, they mimic each other. So the 40, the 60, the preventative, the large ticket items, they're all the same. So it just a little bit more exposure if something catastrophic happens, as opposed to less exposure if something catastrophic happens. The dental plan is very robust. The dental plan starts out, it gives you $50 deductible, and that's only when you get services done. Preventative care is covered at 100%. So you can get 2 cleanings per year with no charge at all. You can just go get your cleanings. You can get x-rays every 24 months, and you can get the routine exam and cleanings, all covered at 100%. Basic services, so fillings, basic oral surgery, those are covered 80% the insurance carrier pays, and then 20% you would pay. So for example, if you go to get a filling and it's $100, the insurance carrier would pay 80%, and you'd be paying the 20%. So they pay $80 and you pay $20. If you get major services, it's more of a 50-50. So when you're getting crowns or periodontics, endodontics, dentures, anything that has major services. So if you go get a crown and they're expensive, so let's say it's a $1,500 charge, you would pay $750 and the insurance carrier would pay $750. The annual maximum out of pocket in the plan is $1,500. So the plan is is right in line and a robust plan. The vision program is great. If you wear glasses, vision is my very favorite insurance. I wear them too. And this plan in general lets you use all the offices that most people use. So Vision Works take it, America's Best takes it, Pearl Vision takes it, Lens Crafters, Walmart, Target. So all the places that you'd want to go besides your eye doctor, this insurance is taken, and that can sometimes be difficult. And so for an exam, you pay $10. There are upgrade costs. So if you decide, if you're like me, I have terrible vision, I have to get all of this stuff. So single vision, bifocal, I don't need a trifocal yet, thank goodness, but lenticular. So any of the upgrades, you just give an additional $10 to make your lenses, to pay for the lenses. They give you $120 frame allowance. But what that means in a frame allowance is that if you decide you want to buy $200 glasses, the insurance company would pay $120 and you would pay $80 to get the 200 glasses. If you choose a frame that's only $100, it's free. So you'd pay nothing for the frames because it's within the $120 allowance. If you say, hey, I already have glasses, I don't really need it, I'm going to get contact lenses, you can use this benefit to get $100 disposable allowance for your contacts. A good tip for vision, though, if you're choosing between frames and lenses and you need both, you should use it for your frames and not your lenses, because it takes you further, because the most expensive part is actually the lenses of your eyeglasses. The frequency is good. So a lot of the vision, because you don't really need glasses every year, is usually a 24-24. This is a 12-12-12, which means you can get glasses or contacts every single year. So it's a really nice benefit and one that differentiates itself from the market. Aflac benefits, like I said, you can get, it's guaranteed issue. So you can get life, there's short-term disability, there's accident, critical illness, and hospital bridge. And what that means is for accident insurance, it plays a flat dollar amount. So if you are hurt and you're, I don't know, riding your bike and you fall off it, they give you a flat benefit if you sprain your ankle or if you break your arm, depending upon what it is. If you get critical illness is also a really good one. If you have a heart attack or you get cancer or you need a major organ donor, you actually get paid for those a lump sum. And then aside from that, if you go to get your physical, they give you a $50 wellness screening credit. So they'll put $50 right into your checking account immediately. As for your hospital indemnity, that pays for those deductibles. So where I showed you the $1,500 and $3,500, you can add a hospital indemnity. And what that does is it makes you have the most beautiful plan ever and have to pay nothing when you go to the hospital, which is really a relief, because usually you have your insurance for those large ticket items. So I pretty much went through the dental and vision in pretty great detail before. So I'm not going to hit too much on here, except for the dental and vision is only $35.30 per employee. I didn't really get to the cost on that one. So you get both programs for $35.30, which is a really good value. And you get that as being part of the association. So because you're part of the Center City Proprietors Association, you can enjoy benefits for all of your employees for $35.30. And you don't have to, you only need one person to enroll. So you don't have, there's no minimum. So unlike when you normally sign up for dental and vision, you don't have a minimum on these because you're part of the association. For ancillary benefits, they're also guaranteed issues. So where you normally have some, if you have diabetes, for example, you don't usually qualify for life insurance, sadly, but underneath this group plan, you can qualify for life insurance. So you get $50,000 guaranteed issue. The short-term disability, which protects your paycheck, also has no wait and it works right away. So those are some good points to point out as being a benefit of the association program. So the timeline, how do we get started? So to get 1-1, how are we going to do that in the next 60 days or 70 days? And so basically 11/2 to 11/20, we're going to run webinars. So there'll be webinars for you as employers, just in case you need a refresher. And you can also have your employees listen to the webinar so that they can find out more about the benefits. If they have any questions, it's a good way to learn about the benefits in detail. We'll go through all the plan summaries during that. We'll do email campaigns, text campaigns about your open enrollment so that you can push those out to your employees. There will be webinars and times to set up. We'll have employee support. So the ongoing webinars, we have an 800 number for questions, and we'll also have email support. On 12/10, open enrollment closes. So as long as your employees have enrolled as of 12/10, we'll close open enrollment. Between 11/7 and 12/10, we'll get final numbers to you, release your location, I'll sign off on final numbers. So on 11/2, you're like, let's jump on it, guys, in the office. Let's just be done with it. If you guys are, do your enrollment, and in a couple of days, we'll get you the rates out in a couple of days, you can actually be completely done by 11/7. It takes about 5 days to finish, usually about 3 to 5 to get your final rates once your employees have submitted their questions. So we can move really quickly. So we're going to do that from 11/7 to 12/10. And then 12/15 to 1:15, we'll do a recap on OE. We're going to do webinars on ongoing administration support. And then between 12/20 and 1/1, cards should be available. So it takes about 7 to 20 days from the day that you submit your final paperwork until the day that your employees get their cards. So it usually takes between 7 and 20 days. So the earlier you get it done, the faster you get your cards. 1/1 is the most popular time to enroll. So I always suggest companies start early if you can, get it done before the holiday rush comes in. So just to see what overall, a recap of what the timeline looks like, the information needed for a company to get started is we need your company info address, your contact info, your EIN, your employee contribution, your wait time for new hires, first of the month following 30 days or 60 days. And that'll be all the information that we need to set you up. That's what's on the setup form. Once the company agrees to the program at each location, they're going to determine an employee flat contribution and or we can leave the medical rates blank for quotes first. And remember, most rates vary between $300 to $500. Average rate is $415 per employee. And employee enrollment begins and underwriting starts. Employees will enroll and pick their plans. Webinars and call center will be up for employee questions. Underwriting is completed and final rates are issued. After that is completed, company approves the rates and plans, and they'll sign off on the final rates, and we'll be off to the races. So here's the 6 steps as an employer that you'll need to do to make sure this is successful. One is you're going to need to let employees know that your open enrollment is coming. So open enrollment's here. We're going to need to do a few things to finish it up. You'll need to complete your setup form. So the information that we need to get the group set up that I just detailed out, we'll need the setup form. You'll provide a census and your contact info. You'll provide employees a link to enroll, webinar info, calendar to schedule employees one-on-one sessions. We'll have an 800 number support line and email for questions. So you're going to be just pushing this out to your employees so that they too have all the information they need to get enrolled, and we'll help you all throughout the process as support. Because we're going to do your billing and administration, we'll need you to complete an ACH form and also to review and sign up on all the final rates and medical program contracts. If you need any help at all, we're here to help you along the entire process. You can email us with any questions you might have, and we can answer, or we can set up a call if needed. The way that employees enroll will be through gowellbenefits.com. It's a super easy site to use. It makes it easy for employees to enroll in benefits. It has 3 steps to do it. They're going to go to the site, which is www.gowellbenefits.com. They'll create an account. They'll click employee. Where you're all going to be issued an employee code. They're going to put in the company code. They'll enter their email. They'll get started. It takes 1 to 3 minutes to enroll, and they're done. You as an employer will get an email saying, hey, your employee's done, so that you know who of your employees have finished it. So it makes this whole process easy. You can do it on your phone. You can do it on your iPad. You can do it on your computer. So anywhere they can do it makes it very easy and accessible. So quick tips to make it easy when they go to do the enrollment is to make sure that they have all their family members' Social Security numbers. So if they're enrolling their family members, they need to also know their Social Security numbers and their date of birth to complete open enrollment. Also, if the question does not apply, they should write NA. So NA is not, if it doesn't apply, just write NA and move on. And then the last thing is that when you're rolling, using any site except for Microsoft Explorer is good. They have Microsoft has sunsetted that one, and so a lot of issues come in with dates of birth when you use that, and you'll probably see that across the board with all sites. So Safari, Bing, Chrome, any other site except for that one. So ongoing support, dedicated customer service team. We'll have onboarding benefits. We'll have an enrollment tool. There'll be reporting, so you can run census reports and payroll reports so that you can get them out to your payroll company to get the updated benefits. We'll do billing administration. So we're going to give one consolidated bill. So all of these will go to one. So you don't have all of these bills coming in. We'll do plan administration and ongoing support. So we'll have 800 numbers and emails for you to use along the way. We're here to support you and your employees all throughout the process. So with that, I want to just thank you again for your time today. We do look forward to working with you. At this time, we can do any questions. I know you probably want to cut it off for the video, but we can do any questions at this time that you might have about the process or the plans.
Thanks, Holly and Michael. Yeah, I've collected questions from the chat, so I'll just get started. Will employees enrolling family members impact the risk pool, generally positively by including children?
Usually, yes. Mm-hmm. Yeah.
If my organization has only one participant, would I need to include my family to meet the 2-person lower limit?
Yes, you need 2 people to start. Now, you don't need that for dental and vision or Aflac, but you do need it for medical. So if you're going to have a medical plan, and this is true for any medical plan, you need 2 people to enroll for a medical plan. Now, as being part of the association, you're able to do dental, vision, and Aflac with only 1 person. So that's a big benefit because you're not able to offer those benefits unless you have 2 people. But because of the association, you can have a one person on the dental, the vision, and the Aflac.
Is there, or can you provide, I guess at another time, a side-by-side comparison of what a small business would usually pay for healthcare for employees versus this plan?
Yeah, so we can do that as if you decide to engage with us, we will look at the market too. So we'll take your census and we'll run it, Independence Blue Cross, Aetna, United Healthcare, and we'll do this program for you as well. Most companies save with the program. So having an association plan, it usually saves most companies money, but we'll just to double check to make sure that, you know, you're not an anomaly as opposed to a typical, we can run the market for you and you can see a side-by-side comparison as we get final rates in.
And to expand on that, interest in the program is not a commitment to participating. It's finding out what the rates are so the business can make the decision. So that's, yeah, there's no, it's not once you get started, you're locked in. It's let's see what the options are compared to what you have now.
Are you able to say what the average yearly percentage increase as everyone ages? How that's?
So it's actually pretty stable. It's a pretty stable market. Usually they see single-digit increases. The trend is anywhere on the market's about 12 to 15%. Actually, Blue Cross is running a little bit light too, 6% increase, I think, for this year. So I think across the board, as more people have insurance, the insurance markets are stabilizing. There used to be more wild changes, but because most people have insurance, there's no pent-up demand. So we see that the markets are stabilizing versus having large increases any longer.
What happens if a member enrolls, then in the future does not renew CCPA membership? Do they get kicked off the plan or go back into the regular rates?
So that would be, again, part of, we'd have to discuss that with CCPA about what the guidance is on that. Typically, to be part of their program, you would need to be a member because you're getting their benefits. So if you don't stay a member with CCPA, it'd be hard to keep their benefits. So I'd have to get the rest of the board to agree, but usually they don't allow the insurance companies don't allow companies that are not affiliated with the association to be part of their program. So you're probably going to stay on the plan.
Yeah, it's designed.
I hate to say no. I hate to say no, but I would think it's no.
Okay. It's a member benefit, I believe.
Yeah.
Thank you. We have a small pool with some participants toward the older end of the spectrum. Is it possible to get an indicative quote based on our pool and census data to determine if it makes sense to move forward.
Oh yeah, of course. And actually, if you have a healthy population of older people, it works out usually pretty well. I mean, obviously, if you're an unhealthy pool of people, it doesn't work out as well. But those are usually groups that really save a lot. Because they're at the highest end of the spectrum in terms of age banded rates. Age banded rates for older employees usually range anywhere from like $600 to $1,200 if your average age is 50 and above. So you're really saving typically under this program. You usually get, a $500 and something rate if you have a healthy group. But we can absolutely give you an idea of what the rate looks like before we get started too.
Can part-time W-2 and or 1099 staff participate?
Yeah, actually, this is a program where 1099 is going to participate.
Okay, and Eric has a question.
Yeah, just good job, Holly, Mike. Good stuff. It's definitely a differentiator. But I have two questions. One is, how are we able to do this given the legislative environment that kind of prevents most associations